Thanks for coming in today, and thanks for agreeing to do just a quick testimonial for our other patients who are considering, and maybe you can help somebody make a decision if we're a clinic that might be able to help them or not. So if you could just tell us a little bit about yourself, your background, and what led you to come to us.
Okay, a little bit about myself. I'm Norman Anderson, first of all, and I'm an enterprise architect, so I design data centers, what they call the cloud. Pretty intense stuff. I work with teams across the world, globally. I have about 9 teams today working with Ford as their chief architect on an intercompany operation called Autonomous Vehicles LLC. My procedure I had on May 10th went fairly well based on Dr. Thomas Nabby's outline of that. 40 minutes, they harvested my stem cells as well as my PRP for the plasma, the platelet-rich plasma, put that in the centrifuge. 40 minutes later, I took a little break, and the next thing they were injecting it into 3 areas, the problematic areas in my hip, my right hip, which had cauliflower-like bone spurs, so it was very narrow. They injected as much of the stem cell as well as the PRP into that area. There was some inflammation pain or post pain afterward, which was like a day or so. But that went off, went away, and next thing I know, in about 2 days, I was walking up and down stairs. I'm with some help with PT. I ended up, doing exercises, lunges and bridges. So now I'm just not only just walking, I'm riding my bike, cycling. Today I am actually doing Tai Chi on the weekends. I am with my girlfriend, and she's a physician too. So she's amazed at this whole procedure. So the fact is that we're walking around at art fairs and things like that. I just feel kind of I'm not. It's not 100%, but I'm 91%, and I'm fully satisfied with Dr. Nabby's procedure in terms of stem cell and PRP.
Thank you. So, in your past life, you were quite the track star.
I was a track star at Michigan State University, 100 meters, 200 meter, and the relay, 4x100, the leg man. So, hey, I still have aspirations, but those are things that I've actually achieved in life, and I'm happy with just doing water therapy and riding my bike. Just kind of in a full kind of. My quality of life is amazing right now. Before I was, during the pandemic, and this occurred during the pandemic, I was pretty much immobile. I barely get out of bed. So, and I have a high resistance to pain, but getting out of the bed was a harsh task to do. Coming to Dr. Nabby again and getting that therapy for the stem cells and PRP was just remarkable, if not a miracle. So thank you. I thank God for that.
And what had you been told was really your only option?
Well, I actually did because I'm kind of a science guy, and I did research, and I went the orthopedic surgeon, the traditional route. They were going to. I went to should I name the hospital or? Yeah.
No, that's okay.
Okay,
yeah.
But I went to the traditional route, and they were going to have me do cortisone shots. So I felt that cortisone shot may last 3 weeks or so. I decided to go this route. It was safer on my joint in terms of joint health, and also I'm in a better space in terms of quality of life, in terms of my diet. I'm a vegetarian now. The supplements help too, but Dr. Nabby provided me in terms of the MSM.
The other supplements, but yes.
The supplements were very helpful. The omegas and the turmeric, and they're all helping too. So again, my quality of life has gone significantly up in terms of lifestyle and being holistic, and more aware of my health and my joints, and as I get older. So I'm looking forward to having a better life with Dr. Nabby's guidance and assistance in the future.
Well, thank you. Thanks for sharing your story. I appreciate it, Norm.
You're quite welcome.
All right.